تفضل.
Okay. Bismillah ar-Rahman ar-Rahim. Today we will discuss current topics in aesthetic dentistry. The topics that we will discuss will include digital smile design, minimal invasive techniques by advancement in adhesive dentistry. Mainly, we will talk about the porcelain laminate veneers restorations. Then we will talk about teeth whitening technologies and injectable aesthetic procedures such as fillers and Botox. After that, we will talk about shades, digital shade matching and artificial intelligence integrated into digital shade matching. Now, what is digital smile design? Digital smile design, it's a digital mode that allows to construct a new smile design by simulating and pre-visualizing the end result of the proposed treatment. فهو بالمختصر انه الفكره انه احنا بنعمل designing للسمايل of the patient in order to simulate and pre-visualize the end results before undergoing any irreversible treatment. يعني قبل ما نبلش اي نوع من انواع التريتمنت احنا بنعمل simulation and pre-visualization of the end results. Digital smile design can be considered as an innovative treatment planning tool. It was invented in 2007 by the Brazilian dentist Christian Kochman. Okay. Now, what are the advantages of digital smile design? First of all, it improves the communication between the patient, dentist, and the technician during treatment planning. Also, it enables the patient to actively participate in their treatment plan. فبالتالي هون البيشنت بيقدر يعطي رأيه، بيقدر يعدل على الوجهة اللي ماشية فيها التريتمنت بلان والديزاين تبع الريستوريشن. Also, it enables the patient أو خلينا نحكي إنه it allows us to enhance the treatment predictability because it allows for a careful analysis of the patient facial and dental characteristics. فبالتالي إنه أغلب السوفت ويرز اللي راح نشوفها بالديجيتال سمايل ديزاين بتعطينا predetermined facial parameters and aesthetic parameters. هاي الاesthetic والfacial parameters will aid us in the analysis of the patient facial and dental characteristics. And finally, by using digital smile design, we can avoid any medical legal issues. لأنه إحنا already ماخذين permission وماخذين consent من المريض إنه راح يكون هو شايف الريزلتس من قبل فاوريدي معطينا approval على الإشي اللي بدنا نعمله. فإحنا بالتالي بنعمل avoiding any medical legal issues.
Can you speak in
Now
English?
we will talk about the evolution.
In English, please.
نعم دكتورة.
يعني حول إنجليزي.
Yes, okay. Okay. Now we will talk about the evolution of digital smile design by Christian Kochman in 2017. Christian Kochman described the evolution of digital smile design in 6 generations as follow. Generation 1 utilized manual handwriting over the patient's photographs with no connection to the study model. So here we started drawing lines and shapes over the patient photographs, and these drawings are not correlated or not connected to any type of a study model. Okay, in generation 2, they utilized a digital two-dimensional drawing using a certain softwares such as PowerPoints, Keynotes, and Photoshop with a visual connection to the analogous model. So here the technician, he has a two-dimensional digital drawing in front of him. And he tried to analog or to simulate what he see on the cast by doing a wax up. Okay, so this we can call this as a visual connection. The third generation includes the digital two-dimensional drawing with analogous connection to the model. So this generation linked the two-dimensional smile design to a 3D wax mock-up. And this was an innovation in the dentistry. The fourth generation progressed from two-dimensional to three-dimensional analysis involving facial integration and predetermined dental aesthetic parameters. In this generation, here we used a specific digital smile design softwares for dentistry. However, in generation 2 and 3, we used softwares that is not specified for dentistry and for digital smile design. So this is the difference between the fourth generation and the previous generations. In the fifth generation, the innovation of intraoral scanners and the ability to produce a 3D model results in complete three-dimensional workflow. So here we didn't use the two-dimensional drawing. We use the three-dimensional designing by using intraoral scanner and producing a 3D model for the patient arch. And finally, and more recently, Generation 6, here the 4D concept was proposed. Here the motion introduced into the digital smile design. We use the digital sensors that are placed on the patient's jaw and capture the smile motion or capture the motion of the patient while smiling. Okay? No. What are the requirements for digital smile design? We need a digital single lens reflex camera or even a smartphone camera to capture the needed photographs. Intraoral scanner to produce a 3D model of the patient's arch and computer with one of the digital smile design software in order to commence a digital smile design. Finally, we need a CAD/CAM processing machine to complete the digital workflow, either to produce the wax up, digital wax up, or to produce a temporary restoration, or to produce the permanent restoration that is designed according to the patient facial and aesthetic parameters. First of all, we'll start talking about the photographs. The following photographic views are necessary. First of all, we need a 3 frontal views, retracted view with teeth apart, as we see here in the right side. Also, we need a full face with a wide smile and teeth apart. And finally, we need a full face at rest photo. Also, we need 2 profile views, both at rest and at smile. 12 o'clock view with a wide smile and incisal edge of the maxillary anterior teeth resting on the lower lip. And finally, an occlusal view of the maxillary arch show from the second premolar to the second premolar. فبالتالي these are the photographs that we are needed in order to do a digital smile design. Now we will talk about digital smile design software. The basic principle or the basic procedure for digital smile design is the same, basically is the same. Although the inclusion of aesthetic parameters varies among different digital smile design software. So we can conclude that all digital smile design software allow for smile designing through the drawing of reference lines and shape, as we said before. These reference lines and shapes can be drawn on extraoral and intraoral photographs. Now, these are examples of different digital smile design softwares that we may use. Okay. Photoshop, Keynote, Plansa, etc. يعني. Okay. Now, as we said, digital smile design allow for smile designing through drawing of reference lines and shape, also known as aesthetic parameters. Okay. Now, extraoral aesthetic parameters include horizontal lines and vertical lines. Horizontal lines such as interpupillary line and intercommissural lines. However, vertical lines include the facial midline. Now, both horizontal and vertical lines are crossed against each other to measure the symmetry and the cant of the face, and they will aid in the digital smile design intraorally, as we will see later on. Okay. Now, what are the intraoral aesthetic parameters? It includes gingival display, which usually determined by the length and the tonicity of the upper lip at rest and in smile. Smile curve, which it's usually established by correlating the curvature of the incisal edge of the maxillary anterior teeth with the lower lip. Now, there are three reference lines that marked on the teeth, which include horizontal line from the canine tip to canine tip, horizontal line on the incisal edge of the central incisors, and finally vertical line passing through the dental midline. Now, few additional lines may be added, such as gingival zenith line and etc. What I want to say that different digital smile design softwares provide different aesthetic parameters or provide something to be an innovative or to يعني عشان يكون مميز الديجيتال سمايل ديزاين سوفت وير. فالبارامترز it depends على السوفت وير on the software more commonly يعني. Now, the need for an aesthetic preview before starting the definitive treatment is well documented, as we said. Previewing the results of an aesthetic restoration can be achieved using either traditional wax up or digital wax up. After that, after the wax up, a mock-up can be created from the wax up and placed in the patient mouth in order to assess the acceptance of the designed smile. Okay, as we see here. Now, in 2021, Mocklin et al. Conducted a study in order to compare the aesthetic results of a diagnostic waxing performed conventionally and digitally from the point of view of both the patients and the dentist. Briefly, in this study, they did a conventional and a digital diagnostic wax up for each patient. 20 patients were included in this study. Okay, and based on each wax up, they provided the patient with a mock-up. After that, they asked the dentists and the patients to fill out the questionnaires. There were three questionnaires. Questionnaire 1 used with the patient to identify duration and the comfort of the dental care. Questionnaire 2 also used with the patient in order to choose the preferred rehabilitation. And finally, questionnaire 3 used with the dentist to evaluate the aesthetic results of both mock-ups, digital with conventional mock-up. Now, they concluded that around 80% of the patients choose the digital method as being more comfortable. However, 65% of the patients preferred the aesthetic results of conventional mock-up. Now, in terms of aesthetic, the dentist opinion was divided exactly in the middle, 50% for the digital mock-up and 50% for the conventional mock-up. Okay. Okay, now this is a video of three-dimensional digital smile design. يعني, okay, we will show in part of it. Okay, we will start with taking photographs for the patient. Then we will select the area that we will work on the software or on the design software. Okay, after that, they took intraoral scanning for both the maxilla and the mandibles of the patients. Okay. 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 Now they are trying to superimpose the 3D model into the patient photograph. So here, any change will be done on the model will show immediately on the patient photograph, as we will see now. Here they still trying to superimpose both the model and the photograph of the patient. And this is the digital smile design, as we see, the white lines. I'll skip a part of it. Okay, now they superimpose the results over the patient mouth. Yes, like this, as we see here. السوبر امبوزيشن اللي عملوه. After that, they transfer this digital smile design into a digital wax up. After that, this digital wax up can be printed in order to produce a printed digital wax up that we may use in order to produce a direct mock-up inside the patient mouth. Okay. Now we will talk about porcelain laminate veneers. Patients' aesthetic expectations have increased recently and reached comparable importance to masticatory function. However, it's important to the clinician to preserve as much natural tooth structure as possible while providing the patient with aesthetic solutions. Now, in terms of aesthetic enhancement, porcelain laminate veneers proved to have a long-term success while ensuring maximum aesthetic and minimal invasiveness. As we know, porcelain laminate veneer require an adhesive bonding procedure in order to be retained on the tooth structure. So, retaining as much enamel as possible is critical for the long-term success of this type of restorations. In this slide, we will discuss the difference between three different definitions according to the glossaries of prosthodontics 9th edition. First of all, facing, it's a general term. The glossary of prosthodontics define facing as a veneer of any restorative material used on the natural tooth structure or on a prosthesis in order to simulate a natural tooth. So, basically, any restorative material applied to the surface of the natural tooth or the prosthesis framework is considered as a facing. Okay. Now, porcelain laminate veneer, they defined the porcelain laminate veneer as a thin bonded ceramic restoration that restored the facial, incisal, and part of the proximal surface of the teeth requiring aesthetic restorations. So basically, it's the ceramic veneers أو المصطلح نفسه اللي بنستخدمه إحنا. Okay. Ceramic veneers, porcelain laminate veneers. Finally, porcelain veneers, it's a layered porcelain that is bonded to the framework. So basically, it's the feldspathic porcelain that placed over a zirconia framework or metal framework and etc. يعني IMAX. Now, what are the indications of porcelain laminate veneer? It includes lengthen or reshape the maxillary anterior teeth, closing moderate diastema, treat congenital tooth malformations such as bilateral teeth, discoloration of anterior teeth that do not respond well to the bleaching, such as tetracycling, fluorosis, and aging, and finally, enamel hypocalcification and fractures. All of these are indications for porcelain laminate veneers. Okay. Now, porcelain laminate veneer fabrication techniques. Mainly, we have three fabrication techniques, include layered, pressed, and CAD-CAM blocks. Layering of feldspathic porcelain. This technique is the weakest due to the incorporation of voids during manual handling or during the fabrication of the prosthesis. However, it has the best aesthetic or the optimum aesthetic result. Pressed glass ceramic. This technique utilizes heat pressing mainly with lithium disilicate. It has this technique has a higher accuracy and minimal internal defect than the layered technique or the previous technique, layered technique. Finally, milling from CAD-CAM block. Veneers produced using CAD-CAM blocks, CAD-CAM milling technique is significantly stronger than that produced using the layering technique. CAD-CAM blocks usually available in single opacity. However, nowadays, multiple opacity blocks are now available, and this limitation was succeeded. Okay. Now, what are the features of porcelain laminate veneer? It's a conservative approach that prevents excessive removal of natural tooth structure. Also, due to their glazed surface, this restoration display decreased buildup of plaque. Finally, it is a fracture prone because of the ceramic thickness, which it may range from 0.3 to 0.5 millimeter. However, once they are bonded to the etched enamel using a resin cement and silane coupling agent, they blend with the tooth structure and develop a better mechanical properties. So its strength came from the bonding of the prosthesis onto the enamel and the tooth structure. Now, in 2016, Morimoto et al. Conducted a systematic review and meta-analysis of survival and complication rates of both feldspathic porcelain and glass ceramics laminate veneers in a median follow-up period of 9 years. They concluded that the estimated survival of glass ceramic veneers was 94%, and for feldspathic porcelain veneers, it was 87%. Also, they concluded that fractures and or chipping of the ceramic material were identified as the primary failure cause, followed by debonding, marginal discoloration, and endodontic problems, which were the second most common causes of failures. However, secondary caries was the least frequent complication. It's around 1%. Now, case report. A 22 years old patient presented with a primary wish of improving the aesthetic appearance of his smile. The patient has a congenitally missing maxillary permanent right canine. However, the primary right canine is still present with a good root condition, as we see here in the photograph. Also, the patient has a big-shaped lateral incisor, multiple diastemas in the anterior maxilla. Now, initially, a virtual smile design and a diagnostic wax-up was made, and an orthodontic treatment followed by 6 anterior ceramic veneers from the canine to canine were planned as a definitive treatment plan in order to achieve a minimal invasiveness. So they decide to do a orthodontic treatment followed by 6 veneers from canine to canine based on the initial virtual smile design and the diagnostic wax up. Now, to meet the patient's high aesthetic demands, as we say, the patient has a high aesthetic demand. In order to meet these demands, an augmented reality, it's a function, augmented reality, was used to visualize the end results for the patient before starting the treatment. Augmented reality can be defined as a technology that superimpose the computer-generated virtual content or design onto a real image, as we see here in the photograph. The digital smile design and the virtual mock-up was superimposed on the patient photograph. This allows the patient to see the final result before starting the treatment. Okay. Now, after the virtual mock-up, augmented reality, virtual data transferred into a digital wax up. Now we want to transfer the augmented reality virtual data into a digital wax up using a virtual wax copy function. This is a function. In this function, the original maxilla file and the new smile file from augmented reality were aligned against each other, as we see here in the upper photograph. And the resulting halo space between the basic or the original maxilla of the patient and the virtual data, the difference between the original maxilla of the patient or original teeth of the patient and the virtual data was filled with a wax using the virtual wax copy function. Okay. Now, after that, they print the digital wax up and perform a real mock-up inside the patient mouth. and they did the preparations through the temporaries in order to be a conservative or to be conservative as much as they can. Finally, they proceeded to veneer fabrication and bonding. This case represent the veneer restoration, porcelain laminate veneers restorations using the digital smile design and or خلينا نحكي full digital smile design. Okay. Now, teeth bleaching. Teeth bleaching is the process of chemical degradation of the chromogenes within the teeth. Bleaching is often used, or it's often desirable when the teeth become stained. Now, what are the active components in a bleaching agent? Hydrogen peroxide is the most used active ingredient in bleaching products. Hydrogen peroxide can be delivered as either hydrogen peroxide or carbamide peroxide. Carbamide peroxide is an analogous of hydrogen peroxide. However, still there are some difference between both hydrogen peroxide and carbamide peroxide. However, they are analogous to each other. Now, bleaching agents, either hydrogen peroxide or carbamide peroxide, break down into a reactive oxygen radicals, which will diffuse into the tooth structure and attach to the organic pigment molecules. They will dissolve these molecules and results in the white tooth structure. Okay, now what are the difference between hydrogen peroxide and the carbamide peroxide? Basically, hydrogen peroxide is an unstable compound. Okay, it's an unstable compound. It decomposes into water and reactive oxygen radical that will interact with the pigment molecules. However, carbamide peroxide is a stable complex. Usually it reacts with water and break down into a hydrogen peroxide. So basically carbamide peroxide will react with water in order to produce a hydrogen peroxide, as we will see here. Okay. This figure shows the reaction of the carbamide peroxide with water. As we see, carbamide peroxide reacts with water and decomposes into urea and hydrogen peroxide. Then the hydrogen peroxide decomposes into water and reactive oxygen radical that will interact or react with the organic pigment molecules. We should know that carbamide peroxide has a 1:3 ratio of hydrogen peroxide, which means that 10% of carbamide peroxide will produce around 3.6% of hydrogen peroxide. So the carbamide peroxide, it has a lower concentration of hydrogen peroxide. Okay. Now, teeth bleaching technique, we have two main techniques: in office bleaching or at home bleaching. In office bleaching performed by a dental professionals, okay, usually by using a higher concentration of hydrogen peroxide, 30 to 38%, okay, and this technique is associated with teeth sensitivity and soft tissue ulceration because we here we use a higher concentration of hydrogen peroxide. However, at home bleaching, usually administered by the patients themselves, it includes application of 10% of carbamide peroxide. Okay, here we know that we used a lower concentration of hydrogen peroxide or carbamide peroxide. We applied this the bleaching agent into a custom tray, and we instruct the patient to warm the custom tray overnight for 2 to 6 weeks. This technique associated with fewer reported side effects, as we said, because we use a lower concentration of bleaching agent over a longer period of time. No, sorry. Okay. Now, activation of bleaching agent. Bleaching agent can be applied with no activation or with activation by using either, or we can activate the bleaching agent by using either light, chemical activator, or a combination of both light and chemical activators. Chemical activators such as manganese gluconate, manganese chloride, and ferrous sulfate. We may use a chemical activator in order to accelerate the chemical reaction of hydrogen peroxide. Therefore, this will reduce the exposure time and the post-whitening sensitivity. Okay. However, power or light accelerated light use the light energy, and the most commonly used light sources are halogen, light emitting diode, and or plasma arc. Now, what are the effectiveness of light activation? In 2019, Keckley et al. Conducted a systematic review to investigate the effect of vital laser activated tooth bleaching regarding the efficacy and post-operative sensitivity. They concluded that a marked color changes was noted for patients undergoing light-activated bleaching independently of the bleaching agent. So they conclude that using the light-activated bleaching agent was an effective treatment modality. Okay. However, regarding sensitivity, the results were controversial. ما كان في عنا اتفاق على results. Okay. Now, also, it was reported that light activation lead to the absorption of energy, which transform into heat. Okay, so the tooth will absorb the light energy and transfer this energy into a heat. This heat will cause a bulbal damage and enamel dehydration. Some relate the whitening of the tooth using light activation systems because of the enamel dehydration. They relate the whiteness into enamel dehydration that results from the light source. Okay. Okay. Now, furthermore, Eldnes et al. In 2004 measured intrapulpal temperature raise inside or induced by a variety of light curing units and diode lasers using an in vitro study tabeto. They concluded that diode laser caused significantly higher temperature increases as compared to other light curing units. So as we see here in the table, diode laser produced the highest temperature compared with the high intensity halogen, conventional halogen, and the light emitting diode. However, there were no significant differences between other light curing unit as shown in the table. Okay. Now, بس دكتور طلع لي انه قبل شوي بده 10 دقائق ما بدي يفصل علينا.
الموضوع البليتشنج خلص ولا لسه؟
طلع لي بجوز من 5 دقائق طلع لي انه بده 10
لا
دقائق
انا
هيك.
شايفه عندي انا could see it I could see it. معك لسه 4 دقائق.
اوكي
كم سلايد باقي للبليتشنج؟
خلصت بليتشنج.
خلاص okay let's stop here okay thank you very much for this part let's stop here take a break for 10 minutes and come back with more exciting information thank you very much.
Thank you.